Hello and welcome to this week's Caregiver Question of the Week. This week it's Thanksgiving, and so I'm about to answer a question that's really appropriate for this week. It's about how to feed someone who has dementia who won't open their mouth all the way. This is actually a really common problem in folks who have more advanced stages of dementia. So I'm going to share a very simple, easy tip that folks can use to help encourage bigger mouth opening and better eating in this situation. But I'm also going to be talking about some of the underlying issues that might cause this and talking about who to reach out to in terms of the medical team to help solve this problem as well. First, though, my name is Amelia. I'm an occupational therapist. I'm also the very proud owner and founder of Higher Standards Caregiver Training and the co-founder of WCN University. That's Whole Care Network University, which is an awesome resource site for family caregivers. This also is for educational purposes only. It's not a substitute for health or medical advice, and it's not a substitute for a therapeutic relationship. So if those are things that you or the person you're caring for needs, make sure you reach out to your individual provider or their individual provider to get those services, as this is only for education. Okay, so jumping right in here, a lot of times, so let's talk about what this looks like. Like I said, it's a very, very common problem. And basically it looks like a person's mouth is like kind of open, but it's not open enough to actually feed that person. Kind of looks like this. So like, it's like kind of, but you can't really safely get food into that person's mouth. It's definitely not like active participation in eating by any means. Often we think about this as a behavioral issue, but really and truly, it's generally related to things, medical issues or things that might be going on related to the symptoms of dementia. So, for example, when people have Parkinson's disease, which often people with Parkinson's disease will also develop dementia, they may not be able to feel that they can't open or that they're not opening their mouth far enough to eat. Certainly people who have dementia with Lewy body also experience movement disorders and may also have problems opening their mouth far enough to eat or recognizing how far their mouth is actually opening. There's also this very common issue in folks who have advanced dementia called paratonia. And paratonia is not super well researched. It's not super well understood. But it's almost like if you're caring for someone with advanced dementia and you need them to move or you want them to move, then that's suddenly when they sort of like lock up. There is a whole caregiver question of the week that's dedicated to paratonia. So you can find that recording on the Higher Standards Caregiver Training YouTube channel. If it's something you're interested in, I definitely recommend checking that out. But so basically, the point that I'm trying to get to here is, although we think of these things as behavioral, they're generally not voluntary. It's related to what's going on with that person's dementia. And of course, we have to keep in mind, maybe that person has jaw pain. Maybe there's an issue with their teeth. So these are things that really need to be medically assessed. That said, I did say I was going to give you a very, very easy and generally pretty effective tip for this kind of issue. And so we'll go over that now, and then we'll talk about how to best utilize the medical team in this situation as well. So this is so simple. It's not going to work 100% of the time. Nothing works 100% of the time, but it does generally have some pretty good success. So you can give it a try. Basically what you do is you take just a teensy-weensy bit of the food that you're trying to get that person to eat, and you just, like with a utensil, a spoon or something like that, you just gently rub it on the bottom of their bottom lip, just a little amount, just enough to get a taste basically. Do make sure you never want to use your fingers to touch someone's mouth or put your fingers inside their mouth. One, just for hygiene reasons, but also because you could get bit and no one wants to get their finger bit, so don't do that. But just with a utensil with a spoon or something, just a little bit on the bottom lip. And what happens is when we have something put on our lips, we sort of reflexively, we lick our lips, right? And that's a great way to do what I call like kickstart that functional eating process. It can help to jog those motor patterns, to help make eating easier and start getting people to actually open their mouth more and get that food in there. It can also increase participation. And of course, it can remind that person that, this is good, I'm hungry, eating is pleasurable, right? So it can work on a lot of different levels. That said, real fast, going along with that, you have to make sure that the thing you're putting on their lip is something that they can taste. So as we get older, all of us, our taste buds tend to not be quite as effective. And certainly with people with really advanced dementia, this is absolutely the case. So a lot of times the last thing that we can taste are sweet and salty. Sweet in particular tends to kind of hang on there the longest. So if this is going to work, it has to be something that this person can actually taste. So keep that in mind. Okay, let's talk real quickly about the medical team in this situation, who you might need. Obviously, you want to talk with the physician of this person about the issue that you're seeing, but it's highly likely you're also going to need an occupational therapist to help with the process of safely getting that person to participate, helping you to feed them safely. And really, it's all about how do we effectively get that food from the plate or the cup or wherever it is safely into that person's mouth in the most effective and safe and pleasant way possible. You also, though, might need to see a speech therapist in order to make sure that that person is able to safely chew and swallow what they're trying to eat. And then you also might really need and benefit from a registered dietitian who can help make sure that that person's nutritional needs are getting met when you're seeing these challenges with actually getting, food into the body when people are having trouble with eating. So it really does take that whole team in order to have the most effective solutions there. Okay, so that was this week's Caregiver Question of the Week. I hope you'd enjoyed it. If you have a caregiver question, please don't hesitate to ask it. You can submit your question using the link that comes along with this post or with this video. You can do it totally anonymously. You don't have to share your name. You don't have to share your email. You don't have to share any information at all except your question, and I will do my best to answer it for you. If I'm not the right person to answer it, then I will reach out to the expert who can, and I will bring them on to Caregiver Question of the Week to take care of that for you. Make sure that you are following me or subscribing if you have enjoyed Caregiver Question of the Week, if you like these answers, so that you can make sure to get updates when new ones are posted. And real quick, fun announcement, I am partnering up with Dr. Brandy Archie from Ask Sammy, totally fabulous site, as well as Maria Lindberg, my other fellow occupational therapist from Toilet Talk. Dr. Brandy is an OT too. Anyway, we are doing a really fun new streaming radio podcast series. It's going to be called Care Lab, and it's going to be coming your way very, very soon. And you're going to be able to listen to it on Whole Care Network streaming radio. So you can download that Whole Care Network streaming radio app right now for free. There's content on it right now that you can listen to, podcasts, music, etc. And soon, Care Lab with myself, Dr. Brandy Archie, and Maria Lindberg is also going to be joining there as well. Okay, y'all, please have a safe, healthy, and happy Thanksgiving. Until next time, stay healthy, stay well, and most of all, take care. Bye.